Hello, good afternoon. Welcome to the NORDIC Health Amplified Nurse sharing by the NORDIC companies. So today is the 8th of June. We have 3 companies sharing. Earlier at 3 and 4 p.m. we have Roommate and Sonitor. And now we're going to have Hublet to share as well. So you missed the earlier 2 sessions, not to worry, we have it recorded. You can email to me and then I can just send you the YouTube channel link. So the next session to promote will be on tomorrow. There will be 2 companies sharing. At 4 p.m. will be Mode Sensors, which is a hydration monitoring system, and at 5 p.m. will be thermal scan, which is a breast cancer early detection system. So the presentation structure will be 30 minutes of presentation and demonstration, and after that it will be followed by a 15 minutes of Q&A. So presentation of the companies have started since yesterday and will last up to 15th of June. Each day there'll be a few companies sharing, and you can look at the schedule of sharing on this link. Registration is also on this link, it's free. If you're unable to attend the online session, not to worry, you still should sign up so that we can send you the recorded link on YouTube accordingly. If there are other challenges that you are facing which we did not cover in this list of solutions, please email to us. We'll be on constant lookout for the solutions. So my name is Nika from Innovation Norway. Here's my number and my email address. So we have a total of 17 companies from the Nordic countries, Norway, Finland, and Sweden. So these are the first 8. And these are the remaining companies. So on the right, you can see the schedule that they'll be presenting. So without further ado, let me introduce Anissa. Anissa from Hublet. She will be sharing on behalf of Hublet today. So I'll stop sharing, Anissa. Remember to click on the share sound. So over to you, Anissa.
Hi, good afternoon, everyone. So I'm Anissa Margono from Hublet. I'm based here in Finland, but I'm actually half Finnish and half Singaporean. So I have actually lived in Singapore and familiar with Singapore as well. I will share my presentation screen now. I hope you're able to all see it. So Hublet, sharing the digital world for healthcare. Hublet is a Finnish company. It's created 2014 here in Finland, and it allows for borrowable tablets, equal and easy access for everyone to access digital content and services. We started with the library market. We are big in the library market, and some years ago, we have now started become big also in the Finnish healthcare market. So from the Finnish healthcare market, we have around 22 hospital districts, which out of already 11 hospital districts are using Hublet self-service tablet loaning system. Hublet solution is used in Finland for both staff and both patients. So we have some hospitals that are using purely for staff use, and we have some hospitals that are using it for both patient and staff, and some hospitals that are using purely for patient use only. I have a video that I will share so you get a short introduction of the solution.
Hublet is a customized learning tool and entertainment center in the same package. Sharing economy is the essence of our Hublet solution. Hublet improves the patient welfare and makes everyday life easier for the staff. The digital content of the Hublet tablets is completely manageable by the hospital.
Hublet's technology drives the increased adoption of digital services for organizations requiring the use of secure and loanable devices.
Patients feel better when they can watch their own programs, play games, or listen to music. It replaces televisions in rooms and magazines in hospital public areas with a much more cost-effective solution. To comply in the best possible way with health tech hygienic standards, Hublet tablets may be provided with an antibacterial protective screen.
Enabling this access is only one part of our actions. Hublet also solves data privacy issues by guaranteeing complete automatic user data removal after each use. Individual tablets do not need to be upgraded, maintained, charged, or cleaned separately. Hublet solution contains a user-friendly, cloud-based Hublet Manager management software, effective Hublet tablets, and Hublet Smart Docking Station.
90% of seniors experienced Hublet as easy to use and very functional for their needs. 100% of all respondents experienced Hublet as safe and secure to use. 75% of the residents felt that the Hublet solution improved their quality of life well or very well. 95% of care personnel experienced Hublet solutions' suitability and functionality for elderly care centers as good or very good. Pretty amazing, right? Right? Are you ready to share the digital world with Hublet?
So that was our Hublet video. We also have several reference videos as well. Regarding Hublet, is a unique solution. It can be used in many ways as a customized learning tool, a work tool, a communication device, and also an entertainment center all in one package. It consists of three main parts. So we have the Hublet tablets. They are Android Samsung tablets, but it has our own software there. It has our own special protective cover. So it helps to have a good grip on the tablet. And also if you drop the tablet, it doesn't easily break as well. Then we have the docking station. The docking station in the screen behind, you can see, is the most common model. We have a version with 6 tablets or 3 tablets. Standing model, which is the common one used that you can move around in different wards. And then we have also a wall-mounted version, which you can drill to the wall. And then we have a Hublet Manager, which is the cloud-based management system. So you can log in from any device and control everything. I will later show you quickly how it works. So Hublet can be used in the healthcare centers and hospital in multiple different ways. One is giving guidance and instructions on patient procedures, treatment plans, rehabilitations, or actually also the surgical information as well. It is being also used for training, both for staff and patients, meetings and workshops, web browsing on the internet, also accessing proper medical information, and also to be able to contact family and friends while staying in the hospital. Entertainment services is very popular use here in Finland. We have hospitals that decided not to have TV instead of fully going on the tablets. Also patient information, so you can do reporting, pre-populate data, and seeing the data information as well, and collecting it, and having feedback forms and surveys answered through the tablet as well. And then, of course, for the nursing staff, the ideal with our solution is that everyone can use it for different purposes. So you have a docking station in the ward, and the staff can go and borrow it and return it. And the moment a patient can use it as well. The same device, but specific content and different setting for different user groups. So Hublet for medical and healthcare facilities. So it is being used as a work tool, very effective, because you minimize of any errors, because you can input the data straight away and you can also access data straight away, meaning you save time and ensuring any human errors has been done. Effective way to show images and reporting as well, patient orientation, input and output of charts, appointment and treatment plans. We are also a collaboration example in Germany in healthcare that you would in future able to register on the Hublet that you have come to the hospital to see which wardroom you're gonna go to. Or you could order even your meals from the Hublet. So there's a lot of different ways to benefit from it. As mentioned previously, training education, you could do remote care and virtual consultation as well. And also for patients to stay connected with their family. We had here in the beginning of the year in Finland really high rates of COVID. So Laakso Hospital here in Finland, which is the COVID hospital in Finland, they had overcapacity. So they have to build emergency hospital because of the COVID cases. So they built an emergency hospital within a week, and they contacted me and said they would really need Hublet there. How fast are we able to deliver? And we delivered within the same week to them, and they needed the Hublet. So the patient, this was especially senior patients that were already had some medical issues, and then they got COVID. So they were isolated, and they were able to communicate with the family through Hublet during their stay in the hospital. So just one experience. We also have material online regarding this use case. For the Hublet solution, I will show you in a minute the Hublet Manager, cloud-based management system where you actually control everything. So what you can do is you can make specific profiles for different patient group and different staff group, meaning when a person loans the tablet, you have already set specific content for that user group as well. From the manager, you can actually make specific loaning periods and also setting on which Wi-Fi network they're accessing the tablets for. The Hublet tablet itself, they have the cover. The end user, they cannot add any softwares, they cannot remove anything. So you actually have full control over the tablets and what the end user is able to do. And it also works only in the predefined network area. So meaning if a person would leave the Wi-Fi area, example, the hospital building, it would inform that you would have to return back to the Wi-Fi area. Otherwise, the tablet would shut down and they're not able to use it. So meaning it's fully secured and in control for you as well. The docking station, the tablets are locked. You cannot take the tablet from the docking station without authentication. So here we have the docking station. As you can see, the tablets are locked. You cannot take the tablet. So I can use different methods to loan. Here's a patient wristband. I have the Finnish healthcare insurance card. So I can use both methods or a QR code or PIN code to actually loan the tablet. I'll show you with the patient wristband. You can have multiple languages and you choose the language, and now it will release me the tablet. And based on who I am as a patient, I would get specific content. So it could be the children's ward, the cancer ward, and so on. Once I return the back, the docking station to the, it actually locks it again. So I cannot take it again. It erases all the data and it starts automatically charging the tablet as well. I'll just show you with my Finnish health insurance card as well. So I just scan again, choose language and choose a method. And now it releases me the tablet. So meaning the tablets are secured and safe on the docking station all time, charges all the time as well, the tablets, and also erases all the data. So meaning if a staff was just using it and returning it back, it zeroes out all the data. And one moment later, you could have a patient coming borrowing the same tablet, but then the content would have specific for that patient. The docking station, usually it's connected with LAN or Wi-Fi, and the tablets are through Wi-Fi. Here's an example of the screen, how it looks from the borrower. So when you borrow the tablet, how the tablet screen looks. I will demonstrate you also sharing my screen and also the tablet. But you can make that the content and the pictures and the text is all specific for different user groups. And from the management, you can make a specific profile and content. I will show you that in a moment as well. I wanted to share that we are collaborating with another Finnish innovation company called Photonit, who has this photocatalytic coating. It's actually very famous and used globally already. Photocatalytic coating actually kills bacteria and viruses based on room light and sunlight. And this coating has been already sprayed on the tablet surface and on the docking station touch screen. It's fully safe for humans and the environment and animals as well. And the coating lasts 1 year, and after 1 year, you can order a kit to spray a new layer on the tablets and the docking station touch screen. So this minimizes risks of viruses and bacteria being spread. From an IT perspective, our solution saves a lot of resources, a lot of time, and in the long run, of course, money as well. Because our system is built that is automated. It charges, it raises all the data, all the software updates are automatic as well. So that means the IT department can focus on other tasks as well. And they don't have to worry about data security. So we never know who has borrowed a tablet. If we are integrated, example, in your healthcare system, it would just check that is a patient and is allowed to borrow the tablet. There would be the example, the identity card number, but we never know who the patient is. So you can see only the card number, and then you can check in your system who has borrowed. Either you can make a PIN code. I will demonstrate in a while how to do that. And with a PIN code, they can release the tablet, or you can make from a PIN code, you can turn it into a QR code. So some hospitals, they use QR codes. The staff gives the patient a QR code, and with a QR code, they can go borrow the tablet from the docking station. So what I will now do is to demonstrate the tablet view. Just one moment. Okay, so at the moment you can see the tablet. You create different content, different pictures for different users. This is just an example. What you do is have a carousel post. So for different patients, you could inform of, okay, fill this survey, or COVID information or security information. So it's up to you, but this could be used to promote services or give important information. Then we have recommended content you can build to put here straight away to access the most common applications, website links that you think they should access straight away and able to see.
Sorry,
then you can build
are you sharing your tablet screen?
Yes, I am.
Because we are still seeing the PowerPoint slide just now.
Good that you tell me. One moment. Let's try again. Are you able to see the view now?
Now it's okay. Yep.
Thank you for telling me. Great. So here you could see the picture. You can choose what kind of picture. Then we have like a carousel post where you can inform the specific information or announcements. You have the recommendation section where you can recommend specific content that they can straight away access and use. And then you can build categories. So it could be physiotherapy, it could be cancer ward. And when they press the box, it would have all the content for that category. So you actually build all the content, what they're able to access and see there. So you could have very specific kind of medical plans, rehabilitation programs, videos, and surveys. If you look at the screen, it's very simple. It's meant that anyone can use it, even if they're a young or old person. The icons and the text is big, especially for senior people. In the top part, you can see how much loaning period they have, and they can also choose different languages. So we have several languages, and we can input also Mandarin, Tamil, and Bahasa Melayu as well. So when they choose the language, it will change the interface language. So this is the view of the tablet for people when they're borrowing the tablet. What I will next show is the actual Hublet manager. Are you able to see a screen that says dashboard?
Yes, but we are seeing, I think, a part of it. I don't know, is it because of the screen size?
Yes, but do you see dashboard?
Yes.
Okay, wonderful. So this is a cloud-based management system where you log in from any device to access the tablets, the content, and the setting. So you could have a quick overview how the tablet's been loaned, number of loans, average loan time, and you can also export out as a report, monthly, yearly, or weekly data. But what is interesting is the profile section. You can very easily and fast create different profile for different user groups. So here example of few different profiles. So you could have cancer ward and children ward, and each profile has different content. Here is an example of, you could have communication, healthcare services, rehabilitation. How to make a profile is very easy. I go to add profile. Just to put example and add a profile. So I made a profile called NUH Kids. I choose the profile. I could put a picture of the hospital or a picture of a nurse or a treatment plan. I go to settings. I could change now the name and descriptions. I could choose to which Wi-Fi this is connected. So different wards could have different connection Wi-Fi. And you can also put SIM card, enable 4G. Example, if the nurse or the doctor is going rounds to different hospitals and they can still use the tablets. Then you can put setting, maybe children's ward are not allowed to use loudspeakers and camera, but you would allow a different profile to have access. And now you can put specific loaning period. So meaning a different profile has a time how long they can use it. So example, 1 hour, and after 1 hour, it shuts down and they cannot use it. They have to return the tablet and do a new loaning session. So that is the basic settings. And to make a content is also very simple. So we could have physio. As an example, I made a category called physio, adult programs, and I want to put the content. So I can choose to upload a file from my computer. I could add a website link or add an application from Google Play Store. So we actually integrated with Google Play Store, and you can choose free applications there. So you can just simply choose the free application you want, select it, and in a moment, you have now Google Chrome on the tablet view. If I press the star, it becomes highlighted recommended content. And if I unclick the star, you would find it under the category physio. As you can see on the view now, we have the content called physio, and it actually has one app. So for you to make specific tailored program content for different user groups is very simple and easy. From the Hublet Manager, you can also make codes, which you can turn into pin codes. So meaning you put a code on the docking station and it would release all tablets or one tablet. You can choose that as well. And you could quickly have an overview of how many tablets are at the docking station. So out of 6 tablets, there is 5 connected at a docking station. And here for the manager, you could also choose the language. So the interface changes the language for you to navigate. Just the example, I quickly choose Finnish. So now all the instructions are in Finnish. So as you can see, it's very simple for you to control this. I will go back to my PowerPoint presentation. So as you can see, the process for a user to borrow the tablet, to return it is very simple and easy. It's very safe, secured, because all the data is automatically erased. It's simple to use. We have seen that hospitals have saved money replacing TVs with tablets. Also, instead of having magazines and newspapers, physical ones, they have choose to go to e-content, and that has also saved money for the healthcare organization. Plus, it's more hygiene as well. For medical staff, it has been a work tool, a very effective one, and it's also easy because, example, in Laakso Hospital here in Finland, the COVID hospital, every ward has one station. So the nurses, when they keep changing the wards, they can just take again a tablet, return it. When they go to the next ward, they have again a station there and they can use the tablet. And when they don't need it, they can return it and someone else can use the tablet as well. So that means your organization doesn't need to have so many different devices for different user groups and different purposes as well. For patient, it has proven to be helping their well-being, especially we have done surveys and it helps the activity level, recovery process as well. The patients has been a chance to get the right medical information. They have felt it's been safe and easy to use as well. And it has also proven that it has helped the healthcare organization saving time because it's been more effective tool to use the Hublet devices instead of other devices where multiple uses and where you have the right information as well. and that you're able to provide the patients the correct information, so you could have the tablet and show example instructions to the patient instead of the nurse have to tell them. So why Hublet? It improves the customer experience and well-being, helping provide the critical content in an easy format that is easy for everyone to use. It has proven to save staff's working hours, as it's an easy management tool where you control everything and can make changes. And from a security aspect, the organization don't have to worry because everything is erased. It only works in the predefined network area as well. And it's easy to use and control, and the tablets are locked and secured as well. For children, many times when we start with new hospitals, they won't not start with the children's ward because they know that it's very popular and it has helped the children during their time in the hospital. So we have reference videos from Laxå Hospital. I think I have a little bit time still, don't I? I can show a quick video of the Laxå Hospital video.
From the start, with the tablets, we had very good instructions on how to disinfect them in a hospital environment, and with the casing that's in use and the different materials that are in use in the tablet, it makes it really easy to clean with sort of cleaning products and disinfectants that we already use in the hospital. I feel like with the patients that are capable of using that tablet on their own and even with the nurses' help, really appreciate, especially since there's no televisions, there's only a radio in the patient rooms. They really appreciate being able to watch television and sort of resume the sort of routine they probably had at home as well. I really think they do enjoy it. I think most patients these days, and especially in the beginning, use the tablet for entertainment purposes. For example, like Yle Areena programs are really popular, just watching either live TV or some kind of recordings. Some patients watch YouTube as well. I don't feel like there has been any kinds of problems with security, either with devices themselves, like they are wiped after each use, so even if a patient logs into some kind of account or any kind of personal information is wiped after the tablet is returned. And tablets don't actually work outside of the Wi-Fi that is here in the hospital, so it hasn't been, or there hasn't been any troubles with security of the tablets.
So that was a Laxå video. We have some more videos, but I know the time is not enough, but just wanted to share that we also have a case study from Senior Center, and the elderly people felt that it was very easy to use Hublet solution. It helped improve the quality of life as well. And we also have surveys from Nordic Healthcare Institutes, the opinion of using digital devices to help their work tasks, and also for patients' welfare during their hospital visit as well. And that also that the Hublet saved time for the organization as well. I will skip the rest of the slides. I just wanted to bring up the challenges that Hublet actually solves. So where to find a cost-effective solution, how to ensure adequate human resources with new digital devices, how can different content be easily created for different user groups, how to take care of data protection, and how are all the updates done, and to ensure that the tablets are not wrongly used, that there's not wrong content as well, and that they're being stolen, and also to make always sure that they has enough battery. That might sound a little thing, but many times for organizations to make sure there's battery and that the data is erased is a very important matter. So I appreciate your time and interest today to join the Hublet presentation. I will actually be coming to Singapore this month on the 24th. So if anyone is interested, I will have my demo unit with me, and I will also be in July in Singapore. I'm really excited to come back home. So if anyone is interested, you can contact and let us know, and we can organize a meeting, and I can come and show you live the solution, and you can touch the tablet and loan the tablet also.
Okay, thank you, Anissa, for the presentation and the information. Yeah, glad to hear that you'll be coming. So for those who want to meet up with her and also have a feel of the Hublet tablet, welcome you to write into us. You can write to my email. I can just then update Anissa and also the Finland team on this request. Yeah. So now we are into the Q&A session. It's open to the floor. You can unmute yourself or can you actually type it in the chat. From the chat, I can see there are already 2 questions for you. One is from Suhan of SGH. She's asking, can the solution be interfaced with hospital application for staff to take notes and medical information?
Yes, definitely. That is very much how it is being used in many hospitals here in Finland. So if you have an application or web link based, so you can put the web address or the application here, and then your staff can access with the logins into that and access the patient information and do the reporting.
Anissa, I'm not very sure whether you're familiar with the Singapore healthcare in terms of the IT requirements. Generally, we are actually internet kind of isolated. So all the devices used by the nurses or the hospital staff will not have internet connection. Yeah. So in this case, I think Suhan is asking whether you will work within the secure internal network of the hospital, where we only focus on the medical software or application that's used within the hospital.
So you can set in which Wi-Fi, you can put in the settings kind of the logins in the Wi-Fi, what is it able to access, so that is possible. We can look specifically then with the IT team and my IT team more specifically how it would work, but I'm sure we would be able to make it work. If it's also an IP-based app that it can be put in, so we can get to see how we could solve that to make it work.
So, yeah, so for Suhan, it'd be good if we want to meet up with Anissa when she's in Singapore, good to involve the IHIS team. I'm not so sure whether there's IHIS member in today's session. I don't quite see that. So involving IHIS at the early stage will be good so that we can identify which are the security hurdles we have to clear.
Yeah, okay. Thanks, Nika and Anissa. Yeah, so if there's interest, you'll contact Nika. But sorry, Anissa, just wanted to check, right? For other use cases, how are the hospitals doing it actually? Are they integrating this solution with their own clinical system, or is it like a separate standalone system?
So it depends. So so here at least in Finland, so many it's like a web-based. So they have put the website address and then they log the staff logs with the initials. We have in some hospital here in Finland done a small integration where it just checks that the patient is a patient at the hospital, so they're able to borrow the tablet. So that's possible as well. So it depends, it's a bit case by case as well. Some hospitals, there's no integrations. The staff is a QR code to the patients that with a QR code they can scan and borrow. So it depends a bit on the hospital.
Yeah, I see. Okay, thank you.
So there's another question from Riku.
So
yeah, sorry, Suhan.
Oh, yeah, it's a good question. So yes, please, any questions, so don't be shy to tell me.
Okay. So one question from Riku, he's asking, are these tablets used in hospital more by healthcare professional or is it by the patient?
So in Finland, it is used more for patients, but when I've been talking internationally, there has been in certain countries more interest to use it for staff use, in some cases only staff use. So I think that also varies a lot differently. Example, in German healthcare market, we seem we're going to be big in the future. We have a lot of interest, and there has been more for the staff use.
So Anissa, for your information, Singapore, actually, we do have both cases. In fact, we have standardized our EMR, basically on Epic or on Sunrise Eclipses. And for staff, there is a movement towards getting them to have a mobile device for the nurses, probably an iPhone. and of course some iPads for them to use for entry of the patient information. And then for the patient use, we are looking at patient bedside terminal, which could again be another use case as well. I think there's some more questions coming in here. From Wansia, she's asking how to track the user return the tablet. Is there patient information that can be accessed via the tablet in case of patient's data information? If a patient data, how to ensure PDPA and data security?
Okay, so first of all, we never know who has borrowed it. If it's integrated with the system to check that they're allowed to borrow, it's only the card number in our system. So we never in any scenario know who has borrowed it. As mentioned, all the data is anyway wiped out once they return the tablet or the loaning time ends. Even the loaning history is only 1 month as saved in our manager. Our server is in Ireland. We are fully GDP compliant. For patients to access their medical information, I don't know how in Singapore, but we have in Finland what is called Omakanta, where they can log in. So it's web-based, they log in and they can access the medical information that the healthcare professionals have input and reported there. So that's how it's in Finland used.
Yeah, Singapore-wise, probably you'll be using one of the patient module from Epic. Yeah. So Wansia, if you have further question, you can unmute yourself if you need to clarify anything.
Because actually, sorry, this is what actually seeing how we are doing the similar project we are having, but we are having a tablet at the patient bedside also. So actually we have a lot of consideration for, the safety of the iPad also. We have to be countable, if the iPad missing. So what we do actually, we lock at the bedside. And also another thing we really is our top priority is because the iPad, we have patient information. We have one app, My Care app. There's a lot of patient information from EMR. And we are very concerned about PDPA. And we don't use, we only can choose iOS tablet. We cannot use other Android tablet, for patient information. I mean, that is a very, we also cannot have web, how to say, web internet, it's only a very secure networking for this only iPad for the patient to use.
Okay, so regarding the bedside, we do collaboration with other Finnish company. I had slides, but because the time was short, so I didn't show it. So we collaborate with another company who has this kind of stands for the bedside. So if the hospital wants to have this kind of to hold it on the bed, that's possible. That's not a problem. Our software is built on the Android Samsung tablets, so it doesn't work with iOS. Regarding that, the accessing the information, so if it's like an API file that we can put in here, that could be one option as well. And as I mentioned that, when they log out or their time ends or they return the tablet, it wipes everything, so never no data is stored. So that way is fully secured, and you and your team don't have to worry about that security wise, because it is wiped out every time.
So Anissa, can I also then further ask, you mentioned iOS is not supported at this moment. Would that be in the roadmap, and when are we expecting that to be ready?
Yeah, so iOS not, because our whole software is built based on the loaning mechanism, the interface, the manager, everything. So it's not in the roadmap for iOS. Unfortunately.
For Singapore, like what Wansia mentioned, iOS is a must-have because we are only certified for iOS use within the hospital.
Maybe that could be changed. We have had institutes where they have taught, but we were able to change their mind, and they were able to test and try for themselves and then compare. So that is my suggestion. It's always good to be open-minded and compare.
Welcome to Singapore.
We have a lot of restriction.
Yeah, I know.
Yeah, hi Anissa. Yeah, sorry, just one more question. Are the tablets actually equipped with data? Does it need internet to work, or is it always connected?
You need internet, so that's a must. For the tablet, you need Wi-Fi. Or you, or you put a SIM card which gives the data.
Okay, thank you.
No problem.
I think one further question on top of that sometimes when you say you need internet, is it okay because yours is Android, is not Apple, because Apple will need internet for the authentication, and that has been posed as a challenge for Singapore when we're trying to implement the iPad for staff use or for patient use. In fact, there has been quite extensive trial on Cambronics. I believe you know who's Cambronics, and also GemF. Cambronics and GemF are the two systems that have been tested in Singapore. I'm not sure of the update. There's no IHIS colleagues here, but those has been things that have been tested in Singapore. And I think what we mentioned earlier, there are some challenges that we are facing, limitation as well.
Understand. Yeah, the internet's connect because of the whole Hublet manager, the loaning time, what you're able to do. So if there's no internet, it's not able, it needs the connection. So it is crucial. But there is a time like some buildings have a moment where there is not Wi-Fi. So I remember now how many minutes it needs to return back. So it still shows that you don't lose it when you get back to Wi-Fi. So it has a bit of like a gap.
I think that's why this program we have IHIS as our partner as well. So if any of you are interested in this solution, I think we should get IHIS involved to work out all the challenges in terms of IT security and also the connectivity.
Sounds good. And we also have experience in collaborating with other software providers who has their applications on our Hublet manager. So that's why the full service of using our solution ends with more what they can do with it as well.
So,
but I am happy to come and meet, as I will be coming there. So it will be easy for me to meet you in person and show you and discuss more further any questions or concerns you may have.
So thank you, Anissa. Thank you for your presentation and the Q&A session. So here's my email address for those who are interested to meet up with Anissa and also look at the tablet. Please write me an email. Then I can then follow up with Anissa to arrange for this meeting together. Okay. So before we end today, I would like to mention tomorrow on the 9th of June, we have 2 sessions, one at 4 p.m. for mode sensors, which is a hydration monitoring system, and also at 5 p.m. Thermal scan, which is the early detection of breast cancer. So thank you for attending today's session. We hope to see you in tomorrow's session as well. Thank you and have a good day. Bye.
Thank you all for today. Thank you for your time and thank you for the organizers. Thank you so much.